Hey folks, welcome back to our anatomy series. We're going to be looking now at the anatomy of the pelvis, so the skeletal structure, and just some of the important landmarks which help us give us reference points for ligaments, muscles, and tendons. So it kind of helps us navigate our way around the body. So if we zoom out a little bit here, so this is the skeleton, and when we zoom in, the pelvis is comprised of three bones. We have the ilium, which is highlighted in green. Then we have the pubic bone, which is this section of the pelvis. And then we have from behind the ischium, which is this part of the pelvis, or this part. So there are three individual bones which, as you grow, fuse together to make one big bone. So it's essentially classified or considered to be one big bone. So whenever you're talking about the pelvis, you're talking about a left and a right pelvis, which makes up the pelvic girdle. And then the pelvis itself then sits in the middle of that is the sacrum, which is the big flat triangular shaped bone. Yeah, so we flip that around. You can see that there. Now the sacrum is a really important bonal structure because it basically unifies the left and the right pelvises together. And then the spinal column sits on top of the sacrum itself. So whenever you move the pelvis, okay, you're going to move to sacrum because essentially the sacrum is it has a little bit of movement. We used to think it was fused together, but now we understand it's got a little bit of movement. But essentially, it's one big bony structure or one big girdle. So when you move the pelvis, you move to sacrum. When you move to sacrum, you move the fifth lumbar vertebrae, and consequently goes up and down the spine. So any positional change of the vertebrae will affect positional change of the pelvis, and then any positional change of the pelvis will affect positional change of the vertebrae. So they're kind of yin and yang. You can't move one without affecting the other at some degree or some level. So this was kind of one of the pieces that makes movement quite complicated because you also have your two legs, your two limbs, two femurs, which sit within the pelvis. So when you move your femurs or when you move your legs, it's going to have an implication or a movement on the pelvis as well. So it all kind of like moves up and down the kinetic chain. So when you hear people talking about sometimes you can have lower back problems, kind of more orientating through the knee or the hip, or your ankle problem, your knee problems coming from your hips. That's kind of what we're talking about because your ankle or knee might be compensating to allow more movement from the hip or lower back if it's got restricted movement, so that the body will try to navigate and allow for movement as much as it can do. So it's quite intelligent in that way, but it can also create some problems in terms of uneven loading and forces moving through the kinetic chain. And then if you're thinking about left and right, are limbs moving evenly, distributing forces evenly, and things like that. So if we kind of come back to the pelvis, I can kind of personally consider the pelvis like one of the five key cores of the body. So you have the pelvic kind of core, so the ability for the pelvis to move in all its directions with control and stability, and synchronicity, and you've got awareness. So is it symmetrical? Is there control? Is there stability? And do you have awareness? So those four key elements. So that's one kind of core. And then the next kind of core would be all your abdominal muscles that are basically connecting the pelvis to the torso. So like your abdominals, your obliques, your back extensors, things like that. Your next core would be your actually diaphragm. You may consider the diaphragm as part of the abdominals because they have such a powerful interrelationship, which we'll talk about in another video. The next core is the back muscles here that control the shoulder blade and the neck and the shoulder. So this whole complex region up through here, which is on a whole video on its own, we'll go over at some point. And then we also have the more the muscles that kind of stabilize the head and keep the head in this nice position where the eyes are level, and then most of your movement and balance is orientated around head position. So this is a really important core. As part of the pelvic core, you've also got the pelvic floor, and then the last one would be your feet, all the muscles that support the arch of your feet. So in my experience as an exercise physiologist is when we can get people's 5 cores working really well together, so they're all communicating and working in unison, and they've got good symmetry and control, stability and awareness, a lot of kind of movement problems, niggling injuries, pain kind of just goes away because the whole kinetic chain is integrated and it's coordinating, it's communicating to each other. So when I'm working with people one-on-one, that's one of the key things that we want to eventually kind of build is this kind of spine that moves really well, breathing correctly, good diaphragmatic control, good pelvic mechanics. So you're anteriorly, posteriorly tilting really well. And then you can kind of align your knees over your feet, and the feet have got good arch and good support. And then you're using your shoulders correctly. So the shoulder scapula and the shoulder are moving in all the different movement patterns it's meant to move into. And then your neck is well supported. So you've got the bowling ball, the head sitting on top of your spine. So when we get all those things working together, it's pretty cool. It's really transformational for many people. It does take some time. It's depending on where people are coming from, but it's definitely doable. But to, underpinning all that is to have our understanding of how movement works, and to understand movement, you kind of need to have a big appreciation of the skeletal system, because muscles contract and they pull on the bones, and that's what creates the movement. All right, so when you contract a muscle, it pulls on the bone, and then the bone has a pull applied to it, and then the joint where the pivot happens allows the bone to move through space. So when we have a look at the skeletal structure, we can kind of see where muscles go, where tendons go, where ligaments go, and that gives a bit of an idea of what's happening. So we can kind of understand a bit deeper, which is pretty cool. But you got to kind of do the little groundwork before we get started. So let's have a look at the key landmarks. Let's come back here. So we've got the ilium. All right, so this kind of big, kind of wing shape. And on the inside, this kind of big dome kind of creates a big dome. And so you'll have all your gastrointestinal organs here and your bladder and things in there. So it's kind of like supporting a lot of your internal organs. And generally where you find big bony structures, they're usually protecting something. So in here, you've got your reproduction organs, you've got bladder, digestion. So really important kind of structures through this region. And on the actual, for more from movement-based processes, the kind of the ridge of the pelvis here, that's called the iliacus or the ilium, or the ridge of the pelvis, or the iliacus ridge. And then from the front, we've got 2 important kind of notches here. So we've got this notch here, and then the one below it here. So this one's called the Anterior Superior Iliac spine. So the spine of the iliac, or the ridge of the iliac. And then you have the anterior inferior iliac spine. Okay, so on this region here, this is where you'll find an attachment point, for example, the rectus femoris muscle and your sartorius muscle. So 2 hip flexors. So the rectus femoris is one part of your quads. So if I add in the rectus femoris, let's move this down a little bit so you get a bit of an idea of it. Rectus femoris. How's my Latin? Rectus sheath, here we go. So there's our rectus femoris there. So what's going to happen is the yellow is the tendon. All right, so it has a kind of a split in the tendon. So it's going to attach onto that bone there. And then as part of the quad, it's not shown here, but that patellar tendon wraps around the patella and then attaches onto that part of the bone there on the tibia called the tibial tuberosity. So what happens is when you contract your rectus femoris, this is a two-joint muscle, meaning it crosses the hip joint and also the knee joint. So it can affect both joints. Let's assume that the knee joint is fixed in extension, so there's no movement of the knee, or it's already extended. So when this muscle contracts, what it's going to do, if you think about the kind of the line of pull, this is the joint here, the ball and socket joint of the femur, of the hip. So as the muscle contracts, it pulls down, it's going to create a pulling action, and it's going to tilt the pelvis in a forward motion. So that anterior superior iliac spine is going to roll forward, and that is going to what's trying to create the anterior tilt. Right. So that's one muscle of many that's going to attach onto the pelvis on that position to create the anterior tilt. Now, if we then put in a antagonist muscle, so for every muscle, there's usually one that does the opposite movement. So let's look at the hamstring. So let's look at bicep femoris, which is one of our hamstrings, bicep femoris. Move the other way on the left. And here on the bicep femoris, this part of the bone is called the ischial or ischium, and where it's attaching on the back is called the ischial tuberosity. So quite a thick muscle is the bicep femoris, a bit thicker than the rectus femoris. If we then contract the bicep femoris and assuming the knee's in a fixed position, it's going to pull the ischial tuberosity in a downward movement, okay, which is then going to tip the pelvis backwards. So that creates a posterior tilt. All right. So you can think the rectus femoris is on here. It's pulling down. It's going to roll the pelvis forward in this direction. If this one contracts the bicep femoris, the hamstring, it's going to roll the pelvis backwards in that direction. So when we're talking about things like muscular balance, we are looking at creating enough strength and stability and neural drive and awareness in the front and the back of the body in the different muscles, so that the joints are kept in, the ideal or optimal position, so that they can do their job and move the body. What happens is you can get things like muscles too tight on one side. So this muscle here might be really tight, or the grip might be really tight, versus the muscles on the back, the hamstrings. And so if you have a fairly significant imbalance, what can happen is you can get more of this kind of tension through the front, which tends to orientate the pelvis a little bit more forward. And then you have this kind of weakness in the back of the hamstring in this position, so it doesn't kind of come back into that posterior tilt. That's important, because if you're lifting anything, it's usually the hamstrings are one of the important lifting muscles. And if it's in a weak position because this anterior muscle is creating too much anterior tilt, it can kind of put this in a weaker position. The muscle fibers are slightly stretched, which is means they don't have as much cross bridging capacity, so they just can't generate as much force. So it's not they're not doing anything; it's just they're weaker. So part of it is this is like retraining the muscles, so it has enough force to neutralize the front muscles to balance it out, and then also to adopting it so it can, contract and relax and return to its resting position, and not being kind of stuck at either end, like too stretched out or too contracted. Right? We want muscles to be able to kind of like contract and relax through the full range of movement, and then return back to a resting position when they're not in demand. So when we understand the anatomy, we can kind of get a bit more of a picture of what's happening with the muscles, and in that way, what exercises do we need to include to address any muscular imbalances, any asymmetries, any lack of control or stability, or even just awareness with our movement. What else we should be aware of with the pelvis is the sacrum here and the Illium, excuse me, the Illium creates the Iliac joint. So this big joint here. So the sacrum itself sits within the two pelvic hemispheres. So if I highlight that, let me fade it. So you can kind of see it's going to sit, and there's a big kind of bony, there's like a rough bony surface on the inside of each ilium, and that kind of like jigsaw puzzles the ilium into the sacrum into ilium. So it's quite a strong, robust joint. Okay. Then you're going to have a lot of ligaments that are essentially holding these bones in position. So if I put in like the sacroiliac ligament, let's have a look, see if we can put one in. So these bad boys here, posterior sacroiliac ligament. So you got a really big ligament, which is essentially connecting that bone to that bone. And ligaments' roles are to kind of keep the bones in position. So we don't typically want to stretch ligaments, because if you stretch them, then they're not really holding the bones in position. They can kind of move a little bit. So then you get what we call more a hypermobile joint. So a joint that has just a little bit excessive movement. Once you stretch a ligament, just the nature and the quality of the ligament structure, they don't really return back to that resting position. They stay kind of stretched. So we tend not to try to stretch out ligaments. And how would you do that? So for example, if you had all your glute muscles were weakened for some reason, maybe for an injury, and you're doing lots of standing work, then the ligament structures in the SIJ joint are going to take more load. And that over time can stress them out more, and that over time can create a little bit of pull and a little bit of laxity. So we always want this nice combination between the ligaments, the muscles, that's the piriformis in there, the tendons, all working together to create stability. So essentially the ligaments are going to hold the bones, the tendons connecting to the bones are going to move the bones, the joint where one bone meets another bone is where the movement's going to occur. And so we're trying to like create this nice balance between all those three things. Now, other important structures to kind of just be aware of is on the front here, we have the pubic bone. So the two pubic bones meet, and there's going to be some cartilage in here, and that's going to keep the two pubic bones nicely connected. And you can get a thing called osteitis pubis, so where the abdominals are attaching on here. So like your rectus abdominis, your six-pack muscles, they structurally attach onto the pubic bone here. And so if you're doing excessive amounts of sit-ups, some people that can cause a bit of a pull on here and an irritation, and that can be quite a painful problem. It's very rare, but it's a thing. Happens in lots of rowers. And you've also got a lot of muscular attachments off the pubic ramus here. So it's that kind of shaft of the pubis bone here. So this kind of thick bone through, which is making part of the pelvic bowl on the front, and then the inferior pubic ramus here, all areas of muscular attachment. So if I put in like an adductor longus, let's have a look at adductor longus. Longus on the left. So adductor longus here is going to attach right onto the pubic bone. Very thick tendon, you can see that. Then it goes into the thick muscle, and then the attachment of the adductors, and we'll do a more detailed video on the adductors, you can kind of see is going, go around a little bit, yeah, mid shaft of the femur. So it's attaching not just on one part of the bone, but like almost a quarter of the bone, maybe a third of the bone has got a tendinous attachment to that muscle. So it's quite a long muscle attaching down there. So when the adductor contracts, if you're thinking about the line of pull, and the line of pull is just follows the line of the fibers, which is the kind of the broad line. So when muscles contract, they just kind of like cross bridge and they slide across each other. So if you think about if the leg is fixed and stable and this muscle is contracting, it's pulling, Okay, it's going to pull the entire femur in and up. Okay, so it's going to pull it a little bit in, what we call adduction, and then also it's going to pull it up. All right, so in and up, primarily in. So and that becomes a strong pelvic stabilizer. So if you imagine you're standing one leg, this muscle here is going to be contracting strongly isometrically to kind of keep this whole structure stable. So when you're on one leg, you're not too wonky. It's an important muscle, often forgotten about. And we'll talk a lot more about that when we do the adductor section, when we get to the adductors. So, but also too, because it's on the front slightly, as it contracts, it's also going to roll the pelvis forward a little bit. So you can kind of create a bit of an anterior tilt with the adductor muscle as well. So the position of the muscles where they attach onto the skeletal structure kind of gives a lot of hints on how to exercise them. So if you can kind of position your pelvis in such a way, or your knees in such a way, you can find the line of pull. And then when you do a stretch or do a strength exercise, you can really feel the fibers connecting. So bodybuilders are really good at this, at finding the alignment of the muscle. And when you do things like yoga for a long time or stretching, you get a real good sense or body awareness of where you need to put your pelvis and where you need to put your leg to find that stretch position. So you can imagine if you want to stretch this one, what you want to do is bring your leg out to the side, okay, in some kind of hip abducted position. So that's probably the key role of the pubic bones. It's attaches a lot of muscles, so abdominals on the front and a lot of your adductors. And then we also, coming around the back, we've got the ischium here. And you'll often hear folks talk about the sit bones. So at the bottom of the ischial tuberosity here, where the hamstrings attach. Okay, if you're sitting in a chair and if you give your bum a bit of wriggle and you kind of orientate your weight onto those two bones, what will happen is your pelvis will basically orientate and stack. And then because you've just put those two positions on the ground, what happens is then that aligns to the sacrum, and then the sacrum aligns to the vertebral column. So what happens is you essentially just align the vertebrae up the vertebral column, and then you just do a little head adjustment, and then the weight of the head sits on top of C1, C2 in a nice position, and vertically it just drops a line straight down the middle. And so the head is going to just sit right over the strong base of support. And then the neck muscles don't have to do as much work to kind of hold the head in position. All right, so if you get that forward head tilt, the neck muscles at the posterior part of the neck become really active to kind of hold the weight of the head, that 4 to 5 kilos, instead of pulling it back a little bit. But if you can orientate your pelvis in the right position, it'll take a lot of load off these neck muscles that are going to be up here, keeping your head in position. A couple other handy little things. Let me get rid of some of these muscles. We have here the sciatic notch. So this big kind of curve here in the bone, this is called the sciatic notch. And so that's going to allow the sciatic nerve to pass through here. So the sciatic nerve is going to kind of exit out from the front, come underneath, hook over through the sciatic notch, hook over this kind of part of the ischium. And you can kind of see there's a little bit of a groove there where it's going to hook over onto, and then it's going to come travel down the back of your leg. And if you get a tight piriformis, if I put that muscle back in, which I just took away, we'll come back. This one here. So if that gets too tight, it will compress down and push on the nerve, and that can give you a pseudo sciatica, like a leg sciatic type pain, which is not much fun. And you can see all the different muscles that's going to attach onto the pelvis. It's quite a lot. I believe it's about 33 muscles on each side. So you've got about 66 muscles on each side that are affecting the position of the pelvis, because it really is like the center of many structures. So let's take off all those layers again, get rid of them all. So in terms of movement mechanics, if you can develop really good pelvic awareness, you'll be able to orientate your pelvis correctly, and then all those muscles will start to contract and relax in the appropriate ways, and then that gets rid of a lot of niggling injuries or movement dysfunctions or things like that. So taking some time to learn how to anterior and posterior tilt your pelvis using the right muscles, and then bringing that kind of awareness into other exercises like a squat, like a deadlift, like a plank, like a lunge, can really change how the exercises feel. And you can resolve a lot of problems just by working on that awareness of correct pelvic mechanics. Other important structures we should be aware of is in here we have, this is the femur. Let me get rid of that connective tissue, get rid of the nerve, and let's get rid of connective tissue. So in here you have the acetabulum. So that's the head of the femur, that's the big ball. So I just isolate that real quick. So you've got a big ball of the femur, really smooth socket. And yeah, here there's a little actually vascular bundle, so blood supply that goes into the bone as well, which is pretty cool. And that smooth socket sits within the socket of the three bones. When they're connected, the pelvis creates the acetabulum. So if I just type in acetabulum, see if we can get a nice image of that for you guys. Acetabulum. Acetabulum, iliac part. So this big circle in here, that's the acetabulum, that's the big hole or the big socket. So that's where your femur will sit into in there. You can see, like, so this is the ilium, this is the ischium, and this part here is the pubic. So those three bones together make up the acetabulum. Biggest joint in the body, biggest ball and socket joint in the body. Let's get rid of these surfaces, we don't need them. Oh, come back to the old thing. There we go. So we want to orientate and train that as best we can. Other important structures we might be aware of here is just the posterior inferior iliac spine, the PSIS. So you can feel these two bony ridges here with your thumbs. Usually you stand behind somebody and you just put your thumbs on the crest of the iliac ridge here, the iliac crest or the iliac ridge, and just kind of like work your thumbs behind. You'll be able to feel these ridges here. And ideally they should line up fairly evenly. You can kind of get your thumbs and look at them. It gives you a nice little rough guide. If like one thumb's up really high, one's down low, it can mean things like you've got a scoliosis, you've got a leg drop, you've got a rotation going on. A little bit of difference is quite normal, but like when it's quite evident, you can really see the rotation occurring. And so it's often not the bones out of position, like a dislocation. It's very, very difficult to dislocate this joint, and very, very difficult to dislocate your hip, although it can happen. It's more that the muscles are going to be tight or weak on one side, and it's the forces aren't even. So for example, if I put in Quadratus Lumborum, which is one of your back muscles, really common lower back muscle here. So if this muscle gets tight, keep in mind that muscles contract and they can only pull. It's going to pull this aspect of your iliac ridge superiorly or up. And so what that's going to do, it's just going to make it kind of superior elevation, or it's going to pull on this bottom rib here, and you're going to laterally flex a bit to the side. So you do a little side bend or a little C-shaped curve from the side, or both happens at the same time. And what that does is that you can kind of see that that would change the orientation of the vertebrae here. So one side would be slightly compressed, one side would be slightly open. Okay. Now, everyone's going to have a little bit of this kind of muscular imbalance going on. It's a big problem when it becomes dominant or quite significant. So if this muscle here is tight, the Quadratus Lumborum, which is a lumbar extensor, so a back bender, essentially, that's going to then lift up this part of the lumbar spine, and it's going to lift up this way and potentially feed into slight anterior tilt, depending on what else is going on in the body. So you kind of get this feedback structure of one muscle creating tension. This PSIS is going to orientate in a slightly different position. Okay, and then you can kind of just like start to kind of like think about how that works up and down the kinetic chain. So if this structure lifts up, then this hip here is going to be a little higher. And again, a little difference is not a big deal, but a big difference is a big deal. And if that lifts up higher, then this side is going to probably have to do more work to stabilize. And so you're going to get some compensatory kind of mechanisms in place. And at the same time, if this side's tight, this side over here is going to be weaker. All right, so if this muscle on its own is tight, it's going to creating that little side bend, then the QL on the opposite side is going to be stretched and a little weaker, so not as effective at stabilizing and supporting the lumbar spine. So you have a little bit of a potential weakness or imbalance that kind of comes out. And so when we're trying to do an exercise program, when we assess somebody, we're looking for these muscular imbalances. So we're looking for symmetry of movement. We're looking for coordination. We're looking for stabilization and control, and we're looking for awareness. And then depending on what we see, we're training people to develop those qualities in their body. So that's a pretty good overall example of some of the pelvic structures and some of the bones, what they're doing, different muscles that attach onto them. Hopefully that gives you a bit more of a feel for the pelvis and how complex it is. And what we kind of need to do, if you really want to understand human movement in terms of musculoskeletal, it really helps to kind of take some time to learn the skeletal structure, every bone, okay, and then learn each individual muscle, every muscle, all the primary movement muscles. And every muscle has what we call an action, okay, which means when it contracts, it pulls on the bone, what does the bone action or the bone movement do? So for example, the Quadratus Lumborum's action is when it contracts on its own, it's a lumbar stabilizer. It also creates lumbar flexion and lumbar lateral flexion. All right, but when they contract together, equally left, right, they both create lumbar extension, so strong back stabilization and movement and support. Okay. So in fact, there's a lot of research around with lower back pain, if you can strengthen this muscle, it really helps in resolving a lot of back issues because it's such an important role in lower backs. And then people tend to avoid exercising it because that's where the pain is being orientated or located, and it's kind of makes sense that you'd be a little bit kind of hesitant to kind of like load it up because it's quite sore, it's quite painful. But after generally the acute phase of an injury, so past that 4 to 5 weeks, when the tissue structures have healed, if it's muscular, then we want to really start to redevelop that strength back in the tissue. And once you restore the strength of the muscle, because it needs enough contractile force to actually resist the forces coming into the body so it can do its job. And so once you can kind of retrain the muscle to have that strength, then it can do its job. And then all of a sudden the game changes and things just kind of fall into line, which is pretty cool. But if you don't retrain that muscle, it stays fairly inhibited or weak, or in a stretch position, and we don't address that imbalance, then we can kind of get into long-term mechanical back pain issues, which then can turn into chronic pain issues, which can then turn into biochemical, neurological kind of adaptations, which then get sticky and messy. And you can definitely get out of it. It just takes a little bit longer and a bit more time and effort. Okay, so often if we can get on top of these things really early, facilitate the healing process of the tissues and the muscles, we can then restore function to the muscles, into the tissues, and off you go. You could do it, rock and roll. But coming back to learning structure, learning an action of muscles, so what they do when they contract, learning their agonist and antagonist role. So agonist is the primary muscle, antagonist is its opposite muscle. So in this example, and the antagonist of the left QL would be the right QL if they're working in like lateral flexion, because if you want to side bend to your left, you have to relax this right QL to allow that movement to happen. So that's called reciprocal inhibition. But it also, you could have front to back as well, because the lumbar QLs create lumbar lordosis or lumbar flexion. Then the muscles on the front, the abdominals, need to relax enough to allow that movement to occur as well. So there's reciprocal inhibition between the two. And another pattern we can see in lower back pain is hypertonic QL. So really tight, short muscles tend to weaken the anterior muscles on the front or the abs. And so then you get weakened anterior core. And one way the body will respond to try to create stability in a weak anterior core is to kind of dump all your load into flexion. So you're resting more on the joints, which then puts more pressure and loading into the ligaments, and then they fatigue out, and then you kind of get joint pain and joint irritation, and that sets up another kind of problem as well. So once we restore the balance between front and back, a lot of those problems just kind of resolve themselves, which is super cool, which is kind of what exercise rehabilitation is all about, trying to help resolve those problems. All right, so I hope you enjoyed that kind of overview of the pelvis, some of the skeletal structures, and some kind of functional anatomy. And we're going to move on, keep working our way out from the pelvis. So we've done all the glutes, we've done the deep pelvic stabilizers, obturator, internus, externus, superior, inferior gemellus. Okay, so I think next stage is we're going to look at the quads. So we'll look at the hip flexors. And to give you a bit of a preview, one of the primary hip flexors is going to be this muscle called psoas, P-S-O-A-S. Let's have a look. That's the fascia. Let me put in. So each muscle has its own fascial wrapping, which is pretty super fascinating. Let's put in the actual muscle. There we go. Psoas, super, super, super important muscle. And so in our next video, we're going to talk about the iliacus and the psoas and the rec fem, the three primary hip flexors, and their actions on the pelvis, their actions on the femur, and their actions on the lumbar spine, and why they're really, really important to get strong. If you can get your hip flexors strong, you're going to resolve a lot of hip problems, a lot of lower back problems. All right, so I'll see you for that video soon. If you have any questions at all, feel free to contact me. You can drop me an email, drop some comments in the comment sections, and please, leave a like, leave a share, subscribe to the channel. If you have any kind of questions, please feel free to reach out. I'm always happy to answer them. Okay, I hope you have an amazing day, whatever it is you're doing, and I'll see you in the next one. Stop the share. And